Hey guys, so the next question is, what is atrial fibrillation? A lot of people know that this is the most common arrhythmia that we see in the United States, and depending on the source, anywhere between 20 to 50 million people in the US may be categorized as having it. And obviously, with the new data from last year, where everybody has a smartphone or an iWatch, they want to know if they have it. So there's a few things you need to know about A-Fib. First of all, the clinical diagnosis of A-Fib means that the upper chambers of the heart, the atriums, do not beat in sync with the bottom part of the heart, which is the ventricles. And usually, those chambers are beating in a disorganized fashion. It's fibrillation. So A-Fib is atrial fibrillation. The atrium alone are fibrillating, because obviously if the ventricles were fibrillating, patients wouldn't do doing very well. That is when you see usually the electrical shocks like in the movies. So how do we treat A-Fib once we diagnose it? Well, we usually break it into three categories. There's rate control. In order to make people feel better, we have to slow down their heart rate. So A-Fib has rate control, and there's a multitude of medications that we use for it. Next is rhythm control. There's patients which we feel rate will not be sufficient at decreasing their risk or symptoms, and we have specialized medications which are different than the rate medication in order to try to improve their chances of going back into normal rhythm. And whether those are chemical medications or whether that's electricity with shocks, we use all those tools in our bag in order to restore rhythm for those patients. And lastly, and just as important as those, the third pillar of treatment of atrial fibrillation is anticoagulation. And again, depending on your risk, and we may use some fancy scores such as CHAD or CHADS VASC, your cardiologist will be able to determine whether you're appropriate to take a full dose aspirin, an actual blood thinner, which is either an oral anticoagulant, something like Xarelto, Eliquis, Pradaxa, or one of the older ones like Coumadin. And of course, some people are actually low enough risk to take nothing. So make sure you talk to your cardiologist.